Anyway. Okay, good evening, everyone. Welcome to our week 3 CAA assessment, Certified Associate Acupuncturist. Today is March 25th, 2023, Saturday. Let's start. Let's start the ball rolling. Okay, first is about emotions, how the emotions can impact the organs. And our general topic is causes of disease. Diba? Meron tayong internal causes of disease and external causes. So let's start with internal causes, particularly the emotions. Who would like to answer the first question? Wait lang po. Bakit lumabas yung sagot? What makes, what is the impact of anger? Anyone?
Yes, Doc.
Who would like to answer?
Darlene, Doc.
Yes, Ma'am Darlene, please.
The effect of the anger of Anchi, anger makes the chi rise.
Okay, like ano yung possible symptoms na mararamdaman? Like what does it mean pag umakyat yung chi? Does everything go to the head?
It means that your liver is activated na ano siya, na pressure siya, so na-activate yung anger mo, na stress. So it rises it makes your chi rise because of the anger.
So you probably have headaches, no? Pati
yes po.
mata mo nalilisik. Maraming salamat. Very good. Kaya dapat hindi tayo magalit. It will definitely affect the chi. Thank you, ma'am.
Thank you po, Doc.
Okay, I think Sir Omer is raising his hand. Would you like to answer number 2? Okay, kanina, yung anger makes our chi go up, no? Or rise. Ano namang emotion will make your chi descend, Sir Omar? Can you unmute po your mic? Sir Omar. So there's a certain emotion. Yeah.
I think anger can induce the liver and cause it to rise.
By what?
And also, I think, sir, the anger can induce the liver and cause it to rise. And also, it causes stagnation.
Were you talking about the emotion? Kanina. Yeah.
I'm talking the effect, sir.
The effect. Okay. So what emotion do you think can make the chi go down or descend?
I think it's the temperature.
The what?
When there's an heated argument.
Argument. Di ba pag you're into argument, that can result to anger. Di ba nag-argue tayo, nagagalit?
Yes, rising the chi.
So kanina, if you notice, the first question was, what effect does anger have on the chi? It makes the chi rise. So the next question, we have to find out, anong emotion po will make the chi go down or descend? Yung naiihi ka.
I think when you are calm, of course.
Yung ano po?
In calm emotion.
Some emotion. Would you like to be more specific?
When you're happy, sir.
Okay, like when you say pag nag-descend, naiihi ka. O natatae, everything goes down. Like, can you think of an emotion that can make you, can make that, can do that?
Yes.
Anyone? Sir Clervin is raising his hand. Sige, we'll go back to you later po, Sir Omer.
Hello, good evening po, Doc.
Ano po?
Good evening po. Si Honey po, gamit ko po kasi yung account ng anak ko na
Okay.
mapasok.
Sige.
Okay po.
Anong
Yung
emotion?
question niyo po sa number 2 po, Doc.
Oo.
Bali po, which emotions makes chi descend? Fear and fright po.
Pride and fear. Yeah. Let me ask you. Isip parang may confusion. Ano po ang difference ng fear sa fright? Or are they the same?
Almost, Doc.
Are you sure? Ano po difference? Aside from the spelling, would you know? Yeah, you're right. Fear can make the chi descend as well as fright. Mahaba-haba lang yung fright, but there's a difference, you know? Which one would require that you see? Okay, ang daming na nag-raise ng hand. Wait lang. Si Ma'am Ana ba to? Clervin? Yeah. Can I ask? Yeah. What's the difference between fear and fright? Di ba pag nakakita ka ng nakakatakot?
Yes po, opo. Parang
Yeah.
siyang parang anxious, parang ganun po.
Is that something more chronic or something acute? Kasi
Parang mas siya, mas mataas yung level niya sa sa fear.
Kasi mas bago, mas nakikita niya. Di ba pag nakita mo, pupugutan ka na ng ulo, di ba?
Parang, opo.
Pero like, when you say fear kasi, andun na yan matagal na. Like when you have phobias. So every time there's a situation that reminds you of the past that has caused fear, naiihi ka. Okay? So I hope, Sir Omer, do you have anything to say? Alam na natin ang anger, nakakapagpaakyat ng chi, ang fear or fright can make the chi descend. I think
The fright
it's more...
because, for example, a frightened cat is running because they don't know where he or she will go. Something like that.
Opo. Yeah. Did you have any personal experience na nag-descend yung chi, nagtae, naihi? Wala naman. I'm sure meron.
I think I am.
Yeah, thank you po. We'll now go to question number 3. Why is a red tongue tip often present in patients with emotional problems related to other organs?
Yes,
Yeah. If you have a red tongue tip, that usually always tells us that you have meron tayong sa heart, no? But the usual case is that pag may nakita kang red tip sa tongue, that usually connotes an emotional problem na hindi po related sa heart.
yes.
Yeah, Dr. Sam, would you like to?
Yes, Doc.
Yeah.
Yes, we know for a fact that the heart is being affected by all emotions, and we know also for a fact that every organ has an emotion. So the function of the heart is houses the mind and consciousness. So that is a fact. So in every emotions from other internal organs actually can therefore indirectly cause heart fire, and that causes redness on the tip of the tongue.
Yeah. Thank you very much. Because the heart feels all of the emotions.
Yes.
No? In fact, it houses the mind. Kaya, of course, when you're so emotional, it definitely affects the mind. And kaya nga marami siyang the heart is actually called the emperor. All the other organs, yung mga tao niya will be affected din po siya. Kaya this will manifest as red tongue tip. Maraming salamat, Dr. Sam. Very good. Let's go to number 4. Explain the saying. The 5 emotions can turn into fire. Who would like to answer this? So you see, all the 5 emotions can turn into fire. Who would like to answer? Can I ask another name? Maybe we can ask Ma'am Angel ko.
Sir, yes, Doc.
It's
Ano po?
ano po
Apo.
ito? The 5 emotions can turn into fire. Can you explain this?
Yes, sir. Bali, the emotions po kasi, nagkakause po siya ng stagnation of chi. When chi is compressed for any length of time, it will lead to heat and then fire. Pag nag-stagnate po.
Okay, very good. So any emotion can actually cause stagnation of the chi. So every time there is stagnation, this will develop into heat. Pag uncorrected pa rin fire. Very good. Maraming salamat po. I'm excited. Number 5. Give 3 symptoms. You can actually give more, no? I'm sure maraming nakaka-relate dito. Sa totoo lang, nakarelate ako dito lately. Anyway. Okay, we would like to answer this. Can we call on... And when I felt this, I was with this very nice friend. Which is wrong timing. He invited me for lunch. Although the food was delicious, ang feeling ko talaga mapait. Kaya inuwi ko yung pagkain. Let us call on Dr. Ryan. Can you tell us the symptoms that could result from anger? Kasi every time we're angry, it causes the chi to go up.
Yes.
Dr. Ryan.
Yes, good evening po lahat. And then also, yung immediate reaction of what you call this, from anger, headache, dizziness, the later reactions na you'd feel is like, the wringing of the neck, so blank, red face, even to a point that the face is flushed, or even experience people that develop hives just because of anger causing your chi to rise.
Okay.
Then later phase, kung palaging angry, namumutla na yung tao. It becomes
Yeah.
unbearable.
At saka nalalamig yung kamay.
Yes.
Kasi lahat ng chi umakyat na sa ulo, no?
Yes.
Sinong nakaka-relate dito? Mukhang si Sir AK. Thank you very much, Dr. Ryan.
You're welcome po.
Siguro naman, kaplastic ka naman if Sir AK, hindi mo ito naranasan man lang.
Normal doc yung yung namumulat saka yung nanlalamig yung kamay.
O kasi
Nag-aalala nga kami sa inyo doc nung nakaraan.
Wag na yan. I tried to forget it. Baka may na-dengue pa sa inyo. Sige na, okay na. Let's just, I have moved on. Hopefully. Okay, let's go to number 6. Give 3 symptoms. Yung mga overexcitement. Hindi rin po maganda yung overexcited. It can affect the heart. And how will you know if the heart is already affected? Can we call on Ma'am Darlene Federico? I'm sure nung nanalo kayo siguro or nakapasa kayo sa board or nanalo kayo ng lotto. I know. Yeah. Ma'am Darlene. Yes. Ma'am Darlene is from Okada, the spa in Okada. Di ba, Ma'am Darlene?
Yes po, Doc.
Okay. Sana mapasyalan namin kayo doon soon, no? And I'm sure
yes, Doc. We're looking forward, Doc. Last March ay yung nung 14. Kaso parang
nagkabulilaso yung schedule po. Oo. Meron pa namang iba. Oo. Don't worry po. Sige po. Ma'am Darlene, could you tell us? Did you personally experience overexcitement?
Yes po, Doc.
So, Ano pong naramdaman nyo? Just give us...
Yung parang nagpa-palpitate ako. Tapos hindi makatulog kasi when you're excited and you're looking forward yung mangyayari kinabukasan, hindi ka na makakatulog. So parang na-insomnia ka. Tapos parang hindi ka
Hindi ka
magkanda-ugaga. O hindi ka mapakalim, hindi ka magpanda-ugaga. Tapos parang yung may namumula yung tongue mo, the tip of the tongue.
Okay. What else? Hindi ka na hindi na tumitigil sa kasasalita, no?
Oh, continuous na excite ka.
Did you know that the heart is connected to speech? So if you can't stop talking anymore, there's a lot of fire in the heart. Maraming salamat, Ma'am Darlene. I hope you're enjoying
it.
And I'm sure ang dami-dami niyang pasyente sa Okada, no? Oo. Paborito ang hotel yan ni Dr. Ryan. Okay, number 7. Medyo ano po ito, but I like this question, no? Complete the following. Who would like to answer this? Maybe we can call on Ma'am Jeliza. Hello, Ma'am Jeliza. Okay, complete the following.
Complete the sentence. The sadness dissolve chi and the affects the heart, and blank affects the heart and the lungs.
Okay. So ibig sabihin po, tinutunaw niya yung chi. So bawal po tayo malungkot. No? Pag natunaw po yung chi, wala na tayong chi, nagkakaroon tayo ng chi deficiency, or as in wala na talaga, mararamdaman mo yan, yung kamay mo malamig, yung boses mo iba na, because it affects both your heart and your lungs.
Yes.
Maraming salamat po, Ma'am Jeliza. Let's now go to number 8. A patient who worries excessively. O, tingnan nyo. I'm sure ba nakaka-relate dito? Parang naramdaman ko rin to. Yung mga, pero hindi naman ako nag-worry too much. Yung last few days lang. Complaints of poor appetite, abdominal distension and tiredness. Ano pong effect nito sa chi and internal organs? Okay, so I think I call on Ma'am Annalyn De Asis. Ma'am Annalyn?
Yes po. So, their worrying has knotted the chi and then primarily affecting the spleen. So, since kasi yung spleen yung nagtatransform and transport ng food chi. So, primarily, the spleen will be affected by knotting of yung knotted na chi. So, parang na-lock yung chi.
Nagkabuhol-buhol.
Nabuhol-buhol because of the worrying.
Kaya nagkaroon ng abdominal distension. Wala kang
Opo. So, yung spleen will be affected.
So, I'm sure because of this example, sa totoo lang, marami pong pasyenteng ganyan. No? And they will be very, very happy na na-detect mo po yun. Maraming salamat po, Ma'am Annalyn. Now, let's go to number 9. How might fear and chronic anxiety? Tama si kanina, si Sir Omer, no? Usually when you are in fear, you also have chronic anxiety. So how might fear and chronic anxiety lead to palpitations, insomnia, night sweats, and dry mouth in an elderly patient? This is something that you have to consider, especially pag yung pasyente mo senior na, no? So can I call on who would like to volunteer? Sir AK?
Yes, Doc. It depletes kidney yin, which leads to empty heat in the heart, resulting into symptoms of palpitations, insomnia.
Actually, very prone po, very susceptible po ang mga elderly. No, lalo na yung mga successful dati. Like, of course, we had to work our way to the top. So I know someone who's like that. And very overachiever in fact. So, pero hindi pa naman siya senior. Yun nga lang, kaya yung mga seniors kasi, pag medyo dati, nung bata-bata sila, medyo na-deplete yung yin, eh syempre, it's normal when you reach the age of 50, 55, humihina na po yung yin. Kaya very vulnerable po yung ganito mga patients. So magkakaroon po ng palpitations, insomnia, no? So this is very, very hard. Maraming salamat, Sir AK. Any questions about this question? How might fear and chronic anxiety lead to symptoms? Opo.
Masasabi ba natin na yung sa mga form of medicine ngayon na yung TCM ang isa sa pangunahin na nagbibigay ng halagahan or importance dun sa in terms of emotions ng tao, na one of the cause ng mga diseases. I mean, it can affect in every diseases. Kasi parang diba, sa Western medicine, parang ang sinasabi lang nila doon, yung mga stress, it releases parang stress hormones lang yun lang yung explanation nila. But in TCM, napansin ko parang dito very particular tayo.
So emotions, yeah.
Yes, Doc.
Ganito kasi, I would like to believe na puro palliative lang, symptomatic. Kasi we don't want the condition to worsen. And ako naman naniniwala na as long as ang pasyente may iniinom na maintenance, hindi talaga masasagi sa isip niya na may sakit siya. So, yun, worry ka ng worry, mamamatay, naubos na yung pera mo, or meron ka ba bang iiwan sa mga pamilya mo? So yung mga ganon. So worrying can, we have learned earlier that it can not the chi. So magkakaroon ka na ng hanto until one thing will lead to another. No? Katulad nito, pag yung isang pasyente mo may night sweats, palpitations, insomnia, dry mouth, and then they would always complain bakit pagdating ng 3 p.m. parang mayroon silang low-grade fever. This is very, very yin deficiency. And this is something that a senior should watch out for, yung fear and chronic anxiety, because this can actually lead to other conditions. Kaya most of this elderly, the seniors, lalo na pag nalaman nila may sakit pala sila, lumalala. Diba? Yun lang yun. Sir Clervin, you were... sino nga ito si Clervin? You were raising your hand?
Ay, hindi po, Doc.
Sige po.
Kahit hindi po. Si Honey to, Doc. Gamit ko kasi yung account sa anak ko. Ay, pumasok ng akin.
Sino po ito? Si
Honey po, Honey.
Honey. Okay, thank you.
Thank you.
Let's now go to number 10. Let's call on Sir Brian Agari, na parang Italian yung name, Sir Brian.
Good evening po, Doc.
Good evening. Paano po nagmamanifest ang shock sa pulso?
Shock is reflected in the moving pulse. Kaya ng short, rapid, slippery, shaped like a pin and seeming to vibrate as it pulses.
So, ibig sabihin, gumagalaw siya?
Opo.
Based on what you have described, would you say na this is very, very, this is very common? Kailan ba nagkakaroon ang isang pasyente? Pag naka-experience ng trauma?
Sorry, Doc, hindi ko po ganong marinig na maayos. Gawa nung nasa province po kasi ako. Kaya yung signal.
Sige lang po.
Sige po.
Pero nasagot mo
Apo.
Sa iyo ba'y nanggagaling kumakanta?
Fiesta po kasi rito. Kaya...
okay, happy fiesta po, Sir.
Naghanap, sa Bicol po. Naghanap ako ng pwesto na medyo
Oo. Pero at least nasagot mo. Paano ma-detect sa pulse pag isang tao? Usually nagkakaroon ng shock pag naka-witness ng murder or
Dok, question lang po, Dok, ha? Dito po sa shock na ito, ano po ba yung shock na to? Every emotions po ba pwedeng yung shock na may mataas na shock o shock na common shock lang, mga ganun?
Shock is something that's
Nabigla, parang
shocking.
ganun po, ganun.
Kung makikita mo yung expression sa picture, mga hindi makapaniwala na nakita niya. Yung mga ganun.
Okay.
Okay. Thank you po.
Parang ano po siya, parang extreme. Hindi siya yung parang nabigla lang.
Extreme. Usually, ang
Extreme siya.
impact niyan yung kidney niya.
Okay po.
Happy Fiesta, Sir Brian.
Thank you po, Dok. Pasensya na po medyo. Yan naman.
Thank you po, Sir Brian.
Thank you po.
Okay, let's go to the effect of external factors. Ito na yung mga mga weather, no? Let's call on Ma'am Annabel Palacio. Ma'am Annabel, are you there? Okay, mukhang na-busy si Ma'am Annabel. Maybe we can call on Ma'am Ivy Salvani. Mukhang buwang na biktima ito sa aking
Nabiktima yan, Dok.
Oo nga, Diyos ko, may utang ako sa'yo. Okay. If a person's defensive chi is strong, how might they become ill through climatic causes? So, take note yung immune system niya malakas. Okay? Paano sila nagkakasakit? Sa climate. O sa climate change. Can I ask Ma'am Ivy? Can you answer, Ma'am Ivy, please? Oh, welcome back from Boracay.
Boracay.
Wow. Talagang
Good evening po.
Good evening po, Ma'am Ivy. Would you like to answer? Kailan po na di ba pag sinabi natin malakas yung ating defense?
Kailan? Ano sa Dok?
Okay, if a person's defensive chi is strong, paano sila nagkakasakit dahil sa climate? Di ba sinabi natin, if your immune system is strong, hindi ka dapat nagkakasakit. Pero bakit sila nagkakasakit sa climate? Or what particular situation sila nagkakasakit?
Dok, pwede si Dok Tom na lang sumagot yan.
Kaya, sige po, may over pa kayo sa Boracay. Kayo talaga. Okay. Sige po.
Okay. Nagkaroon ako ng pimple sa sobrang laki.
Okay po. No problem. Let's call on Ami Glorioso. Ma'am Ami, are you there?
Yes, Doc.
Okay, can you answer the question?
Sir, if a person defensive chi is strong, how might they become ill through climate causes? If the weather is particularly excessive, even a person with strong defensive chi would be relatively weaker, and an external invasion may occur. This may also happen if the weather changes rapidly.
Okay.
Doc, like example, Doc, kapag po halimbawa po, ngayong araw na to is sobrang init
yes.
po.
Opo.
Tapos bigla po na dumating nagkaroon po ng climate change, bigla po siyang umambon, umambon, Doc.
Opo.
Ayan, isa na po yan sa yung immune system natin, Doc, is bumababa po.
Opo, ganito po kasi yan. You have to maintain the balance kasi between the external pathogenic factor and the defensive chi. Pero pag sobra po yung isa kumukonti, gaano kalakas yung immune system mo, kaya natatamaan ka din, no? So
yes,
like
Doc.
yung excessive weather, sobrang heat or sobrang lamig,
sobrang
talagang humihina talaga kahit mamalakas yung defenses mo. Maraming salamat po, Ma'am.
Okay, thank you. Thank you, Doc.
Number 2, can Sir Omer give this a try? Which organ and season are associated with the climatic factor of dryness? Yung atin naman humid no? Ano po, Sir Omer, ang organ and season?
I assume
Po? Nawala si Sir Omer. Okay, maybe we can move. Can we ask Ma'am Lane Arandia? Kasi ganun po yan, 5 elements din yung mga organs, no? Ay, yung mga seasons. Sinasabi
Doc,
dry.
organ po, dryness associated with lungs po, Doc.
Okay, very good. Season, wala naman tayong autumn, pero isipin mo na lang yung autumn leaves, yung nahuhulog na yung mga dahon. Maraming salamat po. Then number 3. Now, this one is very, very important. We would like you to really be familiar with this, no? List the 4 levels formulated by Ye Tian Shu. Which of these levels are classed as being on the exterior and which are on the interior? So, 4 levels po. And first, we need to know, ano-ano po yung 4 levels na yon? The 4 levels of disease. May we call on, okay, ulitin ko na yung ano ha. Okay, maybe we, Sir Omer, would you like to try? So you have to enumerate the 4 levels. Sir Omer?
I wasn't able to read this part.
Ano po yung first level, second, third, and fourth? I think very obvious yung first level, no? Yung pinaka-defense. Opo, Sir Omer. Mukhang sira yata yung mic nyo. Okay, can we pass muna kay Sir Omer? Let's call on Dr. Sam.
Yes, Doc. The 4 levels of as formulated by Yi Chan Shu. One is the defensive qi or the wei qi, and then followed by the qi, nutritive qi, and the second is the sui or the blood. And the defensive qi actually is on the exterior level, and the rest are interior.
Okay. Thank you very much, Dr. Sam. Parang hindi nyo na kailangan mag-aral. Actually, very, very important po ito ha. Dapat alam nyo po, no? You have to read your books. It's all in your books. I think we've given away a lot of books already and I hope you were able to open them. This is very, very important. Meron din tayong tinatawag na 6 levels. But this one is easier, no? Defensive qi or the wei. And then may mga symptoms tayo dyan. And then pag hindi nakayanan ng defensive qi, pupunta ngayon sa qi level. So this time your organ function will be affected. Then we go to the nutritive qi. And then the last one is blood or the shui. Okay, maraming salamat. A person with tendency to heat gets caught in the wind and rain in the middle of winter. What pattern are they likely to manifest? Alam niyo po, nakakakakot po nito. Who would like to answer this? May I call on Ma'am Angel?
Yes, Doc.
Imagine nyo yung pasyente natin may tendency to heat. Okay?
Opo.
Tapos, naabutan siya ng malakas na hangin at ulan.
Magko-combine
magiging
po yung heat tsaka yung wind. Magmamanifest po sa kanya yung pattern ng heat po.
Okay. Kasi may heat na siya. So heat plus wind, wind heat.
Apo.
Okay. So I hope you will all research on what wind heat is. Maraming salamat, Ma'am Angel.
Thank you po.
Okay, ito, very, very important. Can I call on, let's call on Sir Omer again. Sir Omer, how are wind cold and wind heat said to enter the body? Paano sila pumapasok sa body?
Sir, wind cold is said to penetrate by the skin, and
Via the
wind heat
skin. Okay,
and wind heat by the nose and mouth.
very good. So yung wind cold, the skin, kaya nga we're supposed to wear, ano to, yung protector, yung talagang warmers, no? Because they penetrate the skin. Ang wind heat naman, just like the COVID, you have to cover your nose and mouth. Very good. Next, number 6. What is the definition of an exterior pattern? I hope you're enjoying the questions. These are very, very practical questions. Can I call on, may I call on Ma'am Ami Glorioso? How do you define an exterior pattern?
An exterior pattern is defined by the location of the pathogenic factor, being the space between the skin and the muscle channel, the exterior of the body.
So, okay, it's in the space between the skin and the muscles and the channels. Kaya minsan masakit yung likod mo. It's actually the channel. May pumasok na. Pero nasa exterior pa siya. Hindi pa siya nag-interior. Thank you po.
Thank you po.
Very good. Let's go to the next one. How would you distinguish whether a patient who was averse to cold was presenting with an exterior pattern of wind cold or yang deficiency? May I call on... Ang bright nyo, grabe. Okay, may I call on Ma'am Darlene Federico? Ito kasi ang lamig-lamig sa Okada, no?
OA. OA ang lamig doon, Doc. So, to distinguish the weather, the aversion to cold from an exterior invasion arises suddenly and is not relieved by covering oneself. The cold feeling from yang deficiency is chronic and is relieved by covering oneself.
Okay. So which would you rather have? Wind cold, exterior wind cold, or yang deficiency? Oh, aversion to cold, sorry. Aversion to cold. So mas gusto mo yung yang deficiency kasi nare-relieve. So yung mga taong may aversion talaga, kahit anong balot mo, wala pa rin. Kaya dapat doon sa Okada, nagmomoksa kayo parate, no?
Mangangamoy yung Okada.
Ayun nga pala, baka puntahan kayo ng PIDEA. Anyway, maraming salamat po. So,
thank you po, Doc.
Number 8, how would you tell if a patient was manifesting fever without taking the temperature using the thermometer? Oh, let us call a PhD in nursing.
Hi, good evening po. Yung we do the standard test by using the back of the hand to feel for the forehead, and then where it's hot or cold to touch kasi mas maraming we always do that when we're kids. And,
oh yeah, that's part of that's routine, diba?
That's routine. And then also other than that, they would feel warm to touch not only sa forehead but also yung kasi mas malapit sa heart malami dun sa sa neck part din. Meron kasing stages din po yung mayroong stages yung fever. Usually yung cold stages when they feel normal but they are shivering. And then pagkatapos na mag-experience yung heat, and that's how you can tell if they're manifesting fever.
You should know. Did everybody get that?
Yung igaganon lang.
Ganon lang kadali.
Pwede ba dito?
Nakuha mo yon, Sir Brian? How would you tell if a patient is manifesting fever kahit hindi ka gumagamit ng thermometer?
Yes, Doc. Yes, Doc.
Okay, very
Pero
good.
Doc, question lang po, Doc. Di ba meron pong mga sinasabi na lagnat, pero hindi nagmamanifest na mainit sa labas. Parang naramdaman ng pasyente na mainit yung loob niya.
Ibang usapan na rin yun.
Ibang usapan po yun.
Nasa loob. Nasa loob ang
Internal
loob.
heat.
Internal.
Okay, we will get there. Okay. Number 9, give the 3 symptoms of wind. Sabi nyo, di ba yung pinaka-exterior, the space between the skin and muscles, and the defensive chi portion of the lung. Okay. Give 3 symptoms of wind invading. O tinatawag nating wind invasion. No? Ano yung manifestations? Anyone? This is very common po. Lalo na ngayong, di ba there are times na iba talaga yung weather. Who would like to answer this? Can I call on Ma'am Annalyn, the ASIS?
Yes po, Doc Hector. So, symptoms can be fever. So, kung merong fever, it can be may sore throat na din. Then, mag-start na yung sneezing niya. Then, magkakaroon na siya ng runny nose. So, those are the symptoms of wind invading the space between the skin and muscles. So, meron tayong aversion to cold, sipon, fever, the sore throat, sneezing, then magkakaroon na ng sipon, yung runny nose, then occipital stiffness and floating pulse. So, yung pulse niya,
Magagamit
mabilis.
talaga yung yung galing ng mga LMTs dito, no? Pag hinawakan mo yung occiput, sa likod ng leeg, no? Occipital stiffness, that means mayroong wind. Pero you have to also consider the other symptoms. Maraming salamat po, Ma'am Annalyn. Let's now go to number 10. Give 3 examples of exterior cold directly penetrating the body na hindi na dumadaan sa exterior. This is very, very common. Give 3 examples because there are only 3. Yung bang ito na tinatawag nilang lamig, diretso. Who would like to answer this? Sir AK?
Okay, Doc. Give the 3 examples of exterior cold direct penetrating the body without and exterior patterns. Cold invading the stomach, cold invading the intestines, cold invading the uterus.
Okay. Yeah, thank you.
Yun, Doc.
Kaya yung mga babae, what would you advise? Bakit nababaog yung iba? They should not use cold water to clean their area.
Ganun ba yun, Doc?
Oo. Dapat daw punta ka muna, basta mainit-init. Yun.
Masarap manigam.
Masarap kasi
panghuga.
Dapat pala warm lang. Lalo doon sa mga gusto magbuntis.
Cold invading the intestine. Yes. So now alam nyo na.
Lalo na may bayabas.
Now we know, Doc.
Ano kung may bayabas? May bayabas.
Punta na tayo ngayon naman sa miscellaneous causes of disease. What are the causes of a poor constitution? O paano ba to? Namamana ba? Alam niyo, poor constitution, madaling magkasakit, no? Pati itsura niya mukhang sakitin talaga.
Sakitin.
So, what are the causes po? May I call on... Tapos na kaya nag-video kasi na Sir Brian? Okay,
Tapos na po, Doc. Okay na po.
Sige po. Very good. Ano po kaya ang causes ng poor constitution?
Doc, a poor constitution can be caused by parents in poor health, parents who are too old, consumption when drunk, consumption by a pregnant mother of alcohol, drugs, or cigarettes, medicinal drugs during pregnancy, shock to the mother during pregnancy.
Yeah, you see? Thank you very much. Very good. So, nakita nyo yung impact pag pregnant yung mother, di ba? May impact po yan sa ano sa bata. O kung naka-witness ng murder yung pregnant, no? Tapos pinanganak, alam nyo yung ano talagang ano, very sickly. Yun. And also, I think common knowledge naman na if possible, wag kong uminom ng mga alak, magsigarilyo, o magdroga. And then try naman, especially when your parents, when you're already too old, no? You should have done this a long time ago. Yun. So yun ang
Diba, kanina sa pinag-uusapan po natin, yung mga emotions like yung fear, affected na yung kidney, which is one of the nagbibigay ng original chi sa bata. Tama po ba?
Opo. Actually, magiging original chi na rin to kasi namana niyan ito. May kasalanan dito yung mother. Kaya kung pregnant ang babae, dapat
hindi pala talaga doon.
Opo.
Maingat.
So, how about yung ano po, excuse po, yung sa ano, yung mga stress, yung mga emotion, malaking ano rin po yung effect.
Malaking effect nun, as in, yeah. Especially kung pregnant yung babae, tapos emotional, may mga guilt. Actually, I have one patient, okay naman yung isa, 16 lang kasi nabuntis siya, then nahiya yung mga parents. Tapos, alam mo yung anak niya, naging bipolar paglaki. So, yun.
Kasi di po pala talaga.
So, naging medyo may topak, pero naintindihan naman. So, these are the things na dapat natin ma-realize, no? What signs, ito importante to, when you do ear diagnosis, what signs of the ears indicate a poor constitution? When you say poor constitution, masakitin ka. Or baka hindi ka magtagal. Joke lang. Who can answer this? Are we talking about a very big ear? Or are we talking about shrunken ears?
Small ears.
Very small ears. Tapos very short earlobes. So tingnan
earlobes.
Ngayon na-realize niya bakit madaling magkasakit.
So in other words, Doc, yung mga kasabihan dati na kapag ang tao din malaki ang tenga, mahaba ang buhay.
Mahaba ang buhay.
Don't take it too literally. Hindi lang sila magkakasakit.
Yes.
Oo, parang mahaba-haba yung kanilang PC. Ganon. Ibig sabihin, they survive longer. Hindi naman ibig sabihin na yun lang.
Malalim ang basin.
Yes, malalim ang basin. Number 3, what if, ito, overwork. Kaya yung mga iba dyan, ang dami ng pera, work pa rin ang work, no? What effect will overwork over a period of years have on the body? This is very true. Ano yung magkakaroon na pattern na unahin mo? Let's call on Clervin.
Yes, Doc. Question number 2 po. Overwork causes yung deficiency, particularly kidney deficiency and even kidney essence deficiency if extreme.
Yeah, very good. Kasi po, yan. Nauubos yung yin. Pag naubos yung kidney yin, ang next na mauubos yan yung kidney essence kasi mag-withdraw ka na. This time, you will look older than your age. No? Kaya, balansehin lang. Number 4.
Pwede nating dyan, Doc? Pwede nating alternative or na masasuggest natin. Marami talagang overwork.
Ganito kasi hindi mo talaga maiwasan yan. Lalo na pag nasa States ka, you have to work like, I know someone, he would work 20 hours. Sabi ko, ano natira? Alam mo, pagbalik niya, nasira yung kidneys niya, namatay din siya at the age of 50. Oo. Imagine mo, double work. O triple pa yata 20 hours of work. Ilan na yung tulog niya? Kakain ka pa. So ano yung dapat gawin? You have to realize there are 24 hours. 8 hours should be for sleep, 8 hours for relaxation, doing the things you love doing, 8 hours work lang. Pero we can blame it, no? Like, we have to work hard now, especially pag sa Pilipinas tayo. Kaya nga, tinuturuan natin yung iba na mag-level up na. We should have skills. And, diba? You know what I mean. In fact, one dream of Dr. Palanca is to see, she really made mention, the OFWs, na parang hindi na sila dapat umalis, yung mga LMTs na magka-level up na. Kasi if you could see one patient an hour, you could even see three or four if you do acupuncture, di ba? If you do it our way. Di ba?
Yes,
Yung iba nga dyan, dami ng kama yung kanyang clinic punong-puno.
Dok, sa mga bata-bata pa yung massage.
Yung iba gusto talaga massage. In fact, you have to charge more for massage. Yung nga lang, pabagsakan ng presyo, parang napaka-unfair. Anyway, mas maganda, LMT ka, marami ka ibang skills, di ba? Okay.
Opo, mas maraming kita.
Oo, huwag mo naman i-obvious. Okay, number 4. How does lack of exercise affect the qi and cause disease? Anong epekto ng kulang sa exercise? Would you like to answer this, Ma'am? I cannot call siguro Miss Boracay. Ma'am Lane Arandia.
Doc, stagnates the chi.
Okay. Bakit? Nakaupo lang?
Opo, hindi po
Kapag
gumagalaw.
Hindi gumagalaw yung chi.
Opo.
So yung spleen chi humihina, nagkakos ng dampness. Maraming salamat. Clear na to, ha? Number 5. Which patterns might present in patients experiencing either excessive sexual desire or a lack of desire? Ma'am Annalyn de Asis is raising her hand. Ma'am Annalyn, would you like to answer?
Pag excessive yung sexual desire po, it might cause the kidney yin deficiency with empty heat, then or full heat siya of the liver. Then kapag lack of sexual desire naman, it can lead naman to kidney yang deficiency.
Okay.
So
it's the other way around. Kung meron kang kidney yang deficiency, wala kang desire for sex. So you might have spleen yang deficiency, yung mga ganon. Samantala, yung kidney yin deficiency with empty heat, ito yung talagang hot na hot. So you need to be able to do something. If a patient came to you because of lack of desire, then kailangan, after a few sessions, bumalik na
yung essence. Yes.
Maraming salamat.
Mauubos.
Doc, question po.
Okay, sure.
Adun po, Doc, sa ano. Diba, pag sinabi po dito, excessive sexual desire might be caused by kidney yin deficiency with empty heat or full heat. Kasi diba, Doc, pag ang sa kidney, ang yin niya, pinapalamig niya yung heart of fire. Pero kung excessive sexual desire, for example po, diba okay na, yung heart, hindi na po siya nagpapalpitate. Ano lang po, clarification. Paano pong...
Ganito bigyan kita ng example. Pag masyado ka nang kulang sa yin, kidney yin deficiency, dahil overwork ka, umiinit ka na niyan. Although it will take several years. Kaya hanap ka. So definitely, meron ng heat, may fire na, kaya nandoon yung excessive sexual desire mo. So kailangan i-tone down. How are we going to treat excessive sexual desire or ipahinain? You have to deal with the empty heat sa kidney yin deficiency. Okay? So yun. Kasi meron ka ng empty heat, ibig sabihin wala nang coating yung tongue mo. O sino ba dyan yung mga tongue wala nang coating? Yan yung mga hot na hot, no? Tapos pulang-pula na yung tongue. At saka marami silang nagagawa sa tongue nila. Joke lang. And then, So, kaya doon, grabe yung libog nila, no? So, lalo silang umiinit. Pero yung iba naman, yung kidney yang deficiency, kulang sa desire, ito yung medyo malamig yung paa, malamig, At saka parang ayaw nang tumigas talaga. Kulang na sa heat, kulang na sa yang. Okay? So,
Doc
Okay, Doc.
Hector,
Thank you.
di ba sabi doon sa video, na isa sa napanood ko, pag excessive sex daw, nakaka-deplete daw nung essence, yung essence na
yes.
jing.
Oo, lalo na
Opo.
pag na-ejaculate ka. So, lalong nauubos.
Oo. Tapos sa babae naman, pag madami din palang anak, nadideplete din yung essence nila.
Yes. Kaya naubos yung ngipin, nag-ano yung matris, yung lahat.
Oo. Tapos pag kulang naman ng sexual activity, nagkakaroon naman ng liver chi, stagnation.
Yes.
So dapat balance talaga.
Balance. May itatanong pa kaya si Sir Brian? Mukhang maitatanong pa. Mukhang nakaka-relate much.
Wala po. Balance po, balance.
Balance lang dapat. Huwag masyadong
balance na dapat.
Maraming salamat. Number 6. Why do people following slimming diets based on eating a lot of salads and fruit frequently gain weight? Yung iba kasi puro shake na lang ang
Yes.
Who would like to answer this?
Doc, let me try to explain.
Yes,
we know that the spleen is very sensitive or ayaw niya ng malalamig. And itong mga salads po, at saka ito pong mga fruits, they are actually cold in nature. So ayaw po ng spleen yun. So manghihina ang spleen natin. And it will magkaroon ng failure doon sa transform and transport ng food or fluids dahil nga affected si spleen. So therefore, it may lead to weight gain.
Wow. Very well said. Maraming salamat, Dr. Sam. Talagang you are the naturopath of the new century. Okay. Number 7, what effect do beta blockers tend to have on the pulse? Alam niyo naman siguro beta blockers, no?
Yes.
Maraming nagbe-maintain yan. Kaya pag may nakita kayo sa pulse na parang iba, you have to ask immediately, meron ba kayong maintenance medication para sa blood pressure? Okay, let's ask who has not yet. Okay, let's go to Sir AK. Ano po yung epekto ng beta blockers sa pulso?
Bumabagal, Doc. The beta blockers tend to make the pulse slow and deep.
Kaya wag ma-alarma kaagad kasi baka naka-maintenance naka-beta blocker. Okay? Maraming salamat po. Number 8, this is the last. What are the common effects of long-term cannabis use from the Chinese perspective? I think you know what is cannabis.
Marijuana. Mary Jane.
Long-term. Alam niyo ba sa Canada, legal na gumamit ng marijuana? So anong epekto ng long-term na paggamit? Pwede naman gumamit but not long-term. Can I ask, si Sir Brian ba nagmamarijuana? Ay, ayaw sumagot.
Hindi po, Doc. Hindi po.
Wala, tinanong ko lang naman. Okay, Sir Brian. Ano po yung long-term effect ng
Ano po? Long-term use of cannabis seems to cause kidney deficiency and weaken the Z. Tama po ba yung pronunciation ko? As well as adversely affecting the heart blood.
Do you know what is the cheer? The cheer is the willpower. Willpower. Kaya yung mga mahirap talaga mag-recover from their addiction. Okay? It also affects the heart blood. Maraming salamat, Sir Brian.
Thank you po.
Let's now go to your favorite. Let's go to the channels. Ito medyo matindi ito. We have 28 questions. We'll try to finish them. Don't worry. We just took out the most important questions that all of us should know. Let's start with number 1. Where do the yang channels of the hands meet the yang channels of the feet? So I would presume, inaral nyo na po yung mga channel. Tingnan nyo itong picture na to. Ulitin ko yung sa tanong ha. Where do the young channels ng kamay meet the young channels of the feet? So what's the correct answer? I'll show you the picture. Saan sila nagmi-meet?
Sa face po.
Okay, very good. So you got that. The correct answer is face, letter B. Let's go to number 2. Kailangan natin bilisan kasi pag binagal-bagal natin to lalo tayo mahihirapan. And ako kasi naniniwala pag mabilis, lalo na nagkakram. Mabilis pumas. Where do the 3 yin channels of the hand meet the 3 yin channels of the foot? O meeting sila. Pakita ko na naman ito. Ay. Oh. Saan sila nagmi-meet? Yung
Chest po.
Chest. Sa chest.
Okay. Correct answer is the chest. Very
Chest.
good. Number 3. Where do the yin channels and the yang channels na may interior-exterior relationship meet? Ano ba ibig sabihin nito? For example, yung lung, kapartner niya si large intestine. No? Si stomach, kapartner niya si... So ang tanong, saan po sila nagmi-meet? O, tinan ulit. Tinan natin si lung, i-trace nyo saan sila nagmi-meet ni large intestine. Saan usually yung meeting place nila?
Sa kamay or sa paa.
Okay, sa limbs, no?
Forelimb.
Very good. Number 4. All the following organs are linked with the kidney channel. Remember, inaral nyo po yung kidney channel. Remember, kidney channel, sinong partner ni kidney channel sa balancing?
Sila.
The heart.
The heart.
Anong tawag sa kanila po? Shao or lesser yin.
Shaoyin.
Lesser.
And
Hindi sila Taiyang. Shaoyin. Maliit lang yung pagka-yin nila. Ibig sabihin, kung maliit lang yung yin nila, pwede silang maging yang. Now, sino yung mga organs na nakalink sa kidney channel? Except. Alin niyo dito yung except?
spleen.
Okay.
Spleen po.
Liver is connected to the kidney, right? They're always together. Diba? Pag matanda na yung pasyente, affected si liver and vice versa. The heart, alam na natin, heart and kidney. Si lung, anong relationship ni lung kay kidney? Sino siya kay kidney? Lung is metal, kidney is water. 5 elements. Sino yung mother? Sino yung son? Si lung, si mother.
Lungs, mother, kidney, son.
Okay. So, ang spleen ang walang linkage. No? That's number 4. Number 5, the channel entering the ear. Remember, as lung practitioners, we do not say the organ channel. We say, ano ba channel yan? Because we're all preparing you to be talking this way. So pag sinabi mong hand yang ming, we know that we're referring to the what? Stomach or large intestine?
Large intestine.
Very good. The foot yang ming, we're referring to the
large intestine.
Large intestine na naman ulit.
Small intestine, sorry. May ginagawa lang ako.
Ay, bakit ang bagsik? Foot yang ming. Foot yang ming. Anong oras si large intestine, 'di ba 5 to 7?
5 to 7 a.m.
Si 7 to 9 is si stomach. Okay, letter C. Sino si letter C? Foot Taiyang.
Parang nanawag.
Sino ba yung Taiyang na channel? Di ba si bladder and small intestine? Yes. Sino doon si foot? Si bladder. Eh, si Taiyang.
Si bladder.
Si bladder po, yung foot.
Hand na to. O, si bladder, si foot. Itong si Hantayang.
Opo.
Si Hantayang, sino yan?
Small intestine.
Okay. Sagot. The channel entering the ear is?
Small intestine.
What point? Ting kong SI-19. Okay? Kaya maganda yan yung mga parang hindi nakakarinig. Open nyo yung mouth nyo. You can feel a space. There are actually 3 areas there, one of which is the SI-19. Now let's go to number 6. Which of the following channels has a branch which arises from the lung? Nanggaling sa lung, ha? Joins the heart, then runs into the chest. Pakita ko sa inyo yung channel. Ano yan? Di ba arises from the lung? Anong channel yon? Who can give the correct answer?
Foot Shaoyin.
Foot Shaoyin. What channel is that?
Heart and the kidney.
Isa lang.
Kidney.
Lungs and kidney.
Shaoyin, heart and kidney.
So, sino si foot? Sino si hand?
Foot
Si
Shaoyin.
hand, si heart.
Yung sagot mo, foot Shaoyin, so si kidney. So, anong meridian to? This is the kidney. Nanggaling siya sa lungs. Kasi nga mother niya si lungs. Tapos, nag-join siya sa heart. Diba? Yung mga may heart issues, you should always look at the tongue. No? Malalaman mo kaagad kung kidney yin deficiency or kidney yang deficiency predominant. Okay. Next, number 7, the branch of the pericardium channel, which links with the Sanjiao channel, arises from? Ano to sila magkaano ha? Exterior, interior, di ba? Doon sa may kamay. Eh, ang tanong, sino dyan sa 5 na yan? The branch of the pericardium channel na nagli-link sa Sanjiao channel. Ibig sabihin, if you're going to needle the pericardium channel at this point, may epekto po siya sa Sanjiao. By the way, ano po ang pericardium channel? Foot Jueyin or hand Jueyin?
Hand Jueyin.
Hand Jueyin. Si Sanjiao? Shaoyang. Foot Shaoyang or hand Shaoyang?
Hand Shaoyang.
Okay, ano answer nyo dito?
Hand Shaoyang.
The answer is
Pericardium 4.
Pericardium 8.
Pericardium 8.
Pericardium 8.
Okay, ano ibig sabihin yan? Di ba ang pericardium is yin, ang Sanjiao is yang. So, sa pericardium 8, actually we use pericardium 8 if you have heart fire. No? So, kung gusto mong ma-impact, may impact sa Sanjiao, you should use pericardium 8. Okay?
PC8 pala.
So, PC8. PC8. Number 8, which of the following points would you select for the treatment of difficult labor? Baka may mga ano kayo dyan, may mga ano kayo na ano. This is very, very common. You can really help para hindi na magpasipas. Imomoksan nyo habang nagle-labor. What point?
Doon sa paadok yun.
There's 67.
Okay, the correct answer is bladder 67. Letter C. Okay, number 9. Which of the following points would you select for the treatment of malposition? Malposition, pwede maging breach. Ayaw mo mangyari yon. Now, I want you to research at what month, how many weeks, anong weeks mo siya pwede gamitan ng moxa? Umiikot talaga as in. Siyempre, hindi mo na imomoksa kung 38 weeks na, no? Manganganak na siya anytime. So medyo maaga-aga pa dapat. Kaya importante po ang prenatal. Malalaman mo na, ano ba to? Bakit nagbe-breach na, di ba? So pag medyo nakita mo may malposition na, magmoksa ka na. So the question is what point?
Letter C po, Dok.
Bladder
Two letters. Bladder 67.
67.
Kita niyo po siya ng moksa. Number 10. Which of the following points is often used to treat insufficient lactation? Yung mga hindi makapag-breastfeed mabuti.
Small intestine 1.
Yeah, very good.
Intestine 1.
SI1. It's going to be painful. Pwede mong
Yes,
imoksa, pero yung direction ng ano dyan, or gumamit kayo ng lancet. No? Medyo masakit po siya, pero gusto mo mag-breastfeed eh. Diba? Kailangan naman talaga breast milk sa bata. No? Number 11.
Isa pang point sa SI. SI11 ba yan?
SI1. SI1.
SI1. Yes, Doc.
Small intestine 1. Let's go to number 11. The point located in the center of the suprascapular fossa. This, ay, kita nyo na yung point.
SI12.
Okay, kita na. Actually, when you treat shoulder pains, you have to try pressing on all these points, no? SI11, SI12, SI13, 9, 10, dito, mga point na yan. Okay, then you needle that. This is one of those cases na importante yung local points, no? So SI 12. Okay, let's go to number 12. The point located level with Dajui, do 14. Alam nyo, do 14 is very good for fever. We would like you to be used yung bang, alam mo na yung mga sinong kahilera. You remind me ha, I'll probably give you a copy of the notes, yung the same points. Oh, di ba? Ang ganda-ganda. Wala iba niyan. It's in PDF form. Yeah, I'll probably give it to you next week when you have mastered all. Yung bang level, katulad nitong do 14, sino yung kahilera niya? By the way, where it's do 14? Do 14 is between C7 and T1. 7 cervical and thoracic 1. So Google nyo, nasaan yon. I usually use that for patients with fever. Talagang bumababa yung fever po. No? And then the manipulation will be different. Pag fever, you have to sedate it. You have to go against the flow. And pag medyo malamig, you have to go with the flow. But anyway, yung question dito, sino po yung SI point level sa do 14? Can you see it?
SI15.
Small intestine.
SI14.
SI15.
Ay, ano ba talaga?
15. SI15.
SI15. Yan o.
15.
Tingnan nyo ha, o. 15, 14, 13. Pwede mong pasukin yan. Before
17, 15.
10 to 14.
hawakan nyo. Ito, this is a very good point. SI11. Okay, pwede mo tusukan dito, SI10, SI9. Pero before mo siya tusukan, tingnan mo muna kung masakit. Okay? And I have taught you balancing. This is just reinforcement. So yon. Okay? So these are the points you have to, this one, SI11 is so masarap here. And SI12, suprascapular fossa, and then SI13, SI14, ka-level ni DO14, SI15. Now let's go to number 13. The point most commonly used in the treatment of various blood syndromes. When you say blood syndromes, katulad ng blood stasis, blood deficiency, anything that is that has blood issues, no? Ano po yung sagot niyo rito?
Letter C.
Bladder 7.
Letter C.
Bladder
Doc.
17.
Bladder
Bladder
17.
17.
Yes,
Ano
bladder
po
17.
yan? What point is located between the bilateral bladder 17? Ano po yung point between bladder 7? Di ba dalawa yung bladder 70? Ano po yung point na yun?
Do 8.
Wow. Memorized. So I presume you also know where do 4 is. Okay?
Yes.
Do
Even
8.
landmarks that you
Yes.
have to remember. Okay?
Dito do
So that's
4.
bladder 17. So ibig sabihin yung nasa gitna, that's do 8. Okay. Next we go to number 15. Lapit na tayo matapos. The point, heart 8 and pericardium 8, they're commonly used together. You should try this. This really works. As in, what's your answer here?
Clear the fire of the heart.
Clear the fire of the heart.
Yes, puro fire. Paano mo malalaman na may fire ang heart niya? By looking at the tongue.
Sa tip of the tongue, kulay red.
Red.
Grabe, antindihan ba, Bright? Nahiya ako sa mga questions. Okay, what action would it produce when REN23 and kidney 6 are stimulated simultaneously? Where is REN23? Google it. Kidney 6, Google it. So ano po yung action, ano po produce niyan pag in-stimulate mo siya simultaneously? Take note ha, mamanipulate mo sila sabay. Kidney 6, kailangan mahaba-haba yung kamay, yung ano mo, braso mo. Ano po
Relieve
effect
anxiety.
niya? Would like to answer.
Relieve anxiety ba yun? 86.
Why do we use REN23? Nasaan ba yung REN23? Di ba nasa may ano yan?
Sa tiyan po yun.
Magawa ng ano, Aculift. Saka anong pinag-uusapan dito pag REN? Is it about water or is it about dryness? Pag kidney 6, are we talking about yin? Are we talking about yang?
Yang.
So the correct answer is promoting secretion of body fluid to relieve
Yung phlegm natin pala.
To relieve the thirst.
Use of Jueyin genius with relieving phlegm.
Hindi.
Diba?
Doc, number B, promoting circulation of blood and chi, relaxing muscle and tendon. Kasi kidney 6 nasa tendon, Doc eh. Di ba?
Yung REN23 nasa
Di ba pag sa Thursday yan?
jaw, lower jaw.
REN23, nasa ba REN23? Di ba nasa lalamunan?
ng Jueyin?
Basta may lalamunan banda lower sa jaw.
So ano may kinalaman yan sa ano? Relaxing the muscles. Isipin nyo, yung kidney 6 nakakapagpataas ng yin. Correct answer is?
Stomach stop vomiting.
Hindi rin.
D.
Letter B.
No.
Letter B, Doc. Not B?
Letter E.
Letter C?
Letter E.
Letter E. Promoting secretion of body fluid.
Letter E.
Number 17. Which of the following channels has points that are frequently employed? Did you read the extraordinary channel? The 8. Okay.
Yang Shao channel.
Yeah, okay. Number 17, what's the correct answer? Yang Chao.
Yang Chao
Yang
channel.
Chao. Opposite niya is Yin Chao. Yung Yang Chao, it treats insomnia.
Saan ba yun?
Yung parating gising. So yung Yin Chao, yung parating tulog. Which of the following extraordinary channels has points? Okay, ang kaibahan nitong mga channel na to, wala silang sariling points. Humihiram sila ng points sa iba, katulad nito. Okay? Do not be confused. You don't needle those crossing points. All you have to needle are the confluent points. For example, yin chow. I-needle mo yung kidney 6, tapos si lung 7. For women, use the kidney 6 sa right, lung 7 sa left. Pag lalaki, left yung kidney 6, lung 7. Okay? So the same thing with this, SI3 and bladder 62. So that way, pwede mo nang ayusin yung buong channel. So katulad nito, which of the following channels has points that are frequently employed to treat insomnia? So insomnia, we're talking about yang chow channel. So you're going to needle bladder 62, pair it with SI3. May mga pasyente naman na tulog ng tulog. Lalo na yung wala nang ginawa, kundi nakahiga na lang. So kailangan gising-gisingin mo din. You're going to use
Yin chow.
yin chow.
Yin chow.
So, what will you needle sa yin chow? Yin din, kidney 6, lung 7.
Ay, pala so ganun din, KD6 lang 7.
Yun lang.
7.
Oo.
Pag sa
Number
lalaki.
19. Ano po yung function ni CV17 or REN17? Bakit napaka-effective niya?
It smooths the chest and regulating the chi, letter A.
Wow, very good. That's it. Actually the front knee of the pericardium. Number 20. Ito. The 12 regular channels are named after. Natatalo yan sa powers mo, Sir Mark. Hindi rin binasahan na yun. Number 20, letter D. Unahin natin, Zangfu organs muna, tapos hand, foot, and yin-yang. Intindihan nyo? So, una-una, na ipinangalan nila Zangfu muna. Tapos yung hand, foot. Yung inaaral natin na para maging elite tayo. Char. Then yung yin-yang. Letter D. Let's go to number 21. The point between the tendons. By the way, magkakaroon tayo ng course on the muscles. This is your requirement. But I'd like to do this every time we talk about the points. Katulad nito, anong tawag dito sa point na located between the tendons ng semitendinosus and semimembranosus when you flex the knee? This is it. Okay. Flex mo yung
Kidney 10.
Kidney 10. Very good. Number 22. A point frequently selected in treating blood diseases. Ulit lang po ito. Tingnan natin kung maintindihan nyo. Kanina yan. Yung kahilera niya si Do4. At Do8 pala. Do8, sorry, Do4.
UB17?
UB17 or bladder 17.
Bladder 17.
Yan po ang bladder 17. Hanapin niyo po yung ridge ng scapula. Then, how do you locate it? Midline, 1.5 spin. Number 23. Okay. Ano po yung Chong channel? Sinong ka-partner niya? Ang pronunciation niyan, Chung channel. Yung ibang acupuncturists hindi yan alam, pero tayo kunwari alam. O di ba? The pathway of the Chung channel on the abdomen coincides with that of the
Kidney channel.
Ito po yung ating Chung. Yung kanyang ka-partner is Dai, the girdle. Oh. So, if you want to improve the Chung meridian, ano po yung gagamitin mo na points? Confluent points, spleen
N1.
4 with pericardium 6. Thigh meridian, girdle, yung mga sumasakit dito banda, nakikita nyo yan, yung sa may puwitan. Gallbladder 41, pair it with Sanjiao 5. Anyway, you can go through this. I think I gave this to you kanina. I don't know, parang ipadala ko to kasi inayos. Number 24, which of the following statements about the Chung channel is incorrect? So, apat yung correct, isa yung mali. I think you can answer this, Dr. Ryan, because you know the answer for the... No, marami kang memorize. One of that na memorize mo last time when we lost saw each other, it's not supposed to be here.
Yeah, yung ano, what do you call this?
There's a CG.
Ano yung exception dito? Ano exception?
C of Chi.
Okay. Sino ba si C of Chi? Nga ngayong. Yeah, you're correct. Hindi siya C of Chi. So ang tanong ko, kaninong title ang C of Chi? Ren, conception vessel, conception vessel, what? 6 or 4?
6.
Okay. Go. So yung Chung channel is the C of blood, C of the 12 regular organs, C of the 5 Zhang and 6 Fu. Actually, parang niloloko lang tayo. Pareho lang yung B and D.
All of the above.
Hindi, mali. Number 25. The points on the Ren and Du channels. Siguro, Sir Brian, alam mo na saan ang Ren channel. Can you tell us where the Ren channel is? Did you study? Did you watch the video?
Not all po, Doc. Honestly po, not all.
Who would like to answer? Nasaan si Ren? Nasaan si Du? Ma'am Jelaisa?
Si Ren po sa harapan.
Okay.
Nasa hanap po.
So sa likod, si Du. Very good.
Si Du sa likod.
So ano po yung therapeutic effect ng dalawa?
Lumbar ba?
Na very, very common sa mga... Ay, di ko sasabihin kasi makukuha nyo na yung answer.
Gynecological disorders.
Gynecological disorders, no? Kasi if you compare the Ren and the Du, I think I'm going to give this to you later, these notes, no? These are very important. Padala ko sa ano, ha? I think pinadala ko to. Yeah, pinadala ko to, ha? This is the key, eh? Ay, no, hindi pala. Oh, whatever. Okay. From the, yeah, ito yung Ren. So if you want to, if you have issues of front, lalo na sa conception, you have to needle lung 7, then kidney 6. Now, if you have back issues, you needle SI3 paired with bladder 62. So if you want the effect of both Ren and Du, it's very good for gynecological problems. Okay, let's go to number 26. Malapit na po tayo matapos. The reason yin channel points treat disorders of the head is that, so bakit daw maganda gamitin yung mga yin channel points for disorders of the head?
Special function.
Okay, Sir Mark, would you like to answer po? Uy, may mga dumating, hindi ko nakita. Wait lang, tatawagan ko kayo. Sir Herbert. Okay.
Wala.
Ang dami na alam ni Sir Herbert.
Wala pa po ganito.
Okay, ano
I'm
yung
sure
sagot mo dito, sir? Bakit
the reason
ginagamit?
points because of some points of the yin channels have a special function, Doc. Like the governing vessels and gallbladder.
So anong sagot dito?
The yin and yang channels are related through the duo and ren channel.
Are you guessing or you know the answer? Okay, I want you to read on the divergent channels and the 12 regular channels. Divergent channels, ito yung galing sa ibang channel na parang yun, naglihis ng landas kaya naabot sa muka, sa ulo. Okay? So the correct answer is letter D. But for now, that is what you should remember. It's because of the close relationship between the divergent channels and the 12 regular channels. By the way, hindi ko kayo masyadong pasusukahin sa dami ng channels. Magpapahinga mo tayo ng channels konti. We'll probably talk about the chi na naman, types of chi and all. And then we go to the channels again. Then we go to the okay? Next, number 27. Each of the following organs has a connection to the course of the kidney channel except
the spleen.
The spleen.
Oh, yun pa rin, no? Favorite question. Okay, sino makakasagot sa... Okay, yan po yung ating kidney channel. Number 28. Last question. Which is the most likely order na na-discover yung acupuncture points? So this is a little bit on history. Common sense, tell me, paano kaya nila na-discover yan? Where did they all start? Did you even wonder? Bakit nila alam?
Nag-asyo muna sila.
C.
Kapakapa.
Sige, Sir Mark.
Nagkapakapa muna sila. Letter C. Ashy points of the 14 channels, extraordinary points.
Ang galing. What are ashi points, Sir Mark?
Yung kapakapa.
Painful points.
Yung mga painful
Ashley
points.
po yung pinaka-masakit, pinaka-painful po.
Yung mga trigger points na painful, Doc.
Okay, very good. So, yan po yung ating letter C. Do you have this in your notes? You don't have this, no? Oh, there's the answer. Ito, importante po ito. Kailangan nyo itong memorizein. Ren meridian versus the...
Panonoorin ko ulit ito.
Ha? Paulit-ulit lang naman yung question, di ba?
Apo.
So maraming salamat sa lahat. Let's evaluate, I'd like to hear from you, your assessment. Sino ba yung mga huling dumating? Okay. Are you happy with the way things are going? Let's ask Sir AK. Nagbago ba yung appreciation mo for acupuncture?
Yes, Doc.
Do you think we're doing the right thing?
Yes, Doc. I think maganda yung ganito, Doc, kasi mas nagiging systematic yung kung paano tayo mag-aral ng TCM. Tapos, I think mas magiging mahusay yung mga practitioner kasi mas na-explain o mas naipapaliwanag din doon sa mga pasyente kung ano yung mangyayari at ano yung nangyayari.
Okay, thank you, Sir AK. I think Sir Omer is raising his hand. Sir Omer, do you have some issues to raise? Are you happy with...
Yes, sir, very much. Because
to know more about this.
Paki-adjust po ng audio nyo, Sir Omer. Sir Omer. Nawala si Sir Omer. We'll get back to you later. Let's call on Ma'am Angel na talagang kanina pa dumating. Wala pang ano. Nakakahiya nga eh. Medyo na-late ako kasi I was in another Zoom. But anyway, Sir, Ma'am Angel, what is your honest assessment? Wag yung ano ha, yung puro lang positive. Because I need negative comments so that we can work on that.
Maganda naman po yung assessment, sir, kasi parang na-explain po ng mabuti. Kumbaga, yung mga natutunan namin, mas nabibigyan po kami ng linaw kung tama po ba yung pagkakaano namin sa kanya, pagkakaunawa. So maganda po yung naging assessment po.
Ano yung dapat nating i-improve? Or ano yung gusto nating idagdag? Do you think, kasi alam nyo medyo matindi itong channels and acupoints eh.
Yes po.
I'd like all of us to be very familiar with the points, especially the location. I was thinking kasi, kahit sa module 2, kasi dahan-dahan na natin i-integrate yung biomedicine. Ito yung anatomy. So we need to be very particular. If you notice now, we're not so particular about the location, but you can Google it naman eh. Pero in the future, you need to be very, very precise with the location. And this is where knowledge of acupuncture, knowledge of anatomy will be very, very important. So, ano po yung dapat i-improve, Ma'am Angel?
Ali po, yung kanina sir, nabanggit niyo po, Doc, yung maganda po na magkaroon po tayo ng isang course para po sa mga muscle, kung ano po yung mga tawag. Kasi hindi po natin minsan parang familiar kung ano pong muscle yon or saan. Para mas maganda po yung pagkahanap natin sa mga channel points para maano po natin yung mga channel or muscle, saan po yung pinaka-location, ano po yung sukat ng yung 1 kun, 2 kun, 1.5, ganyan
sige,
po.
yeah, okay. So sige, ipapasok ko yan next week. Gusto nyo? I have several PowerPoint presentations on that. Yung mga very common lang talaga. Okay? Yeah, thank you for that. So I'll try, hindi pala try, gagawin pala natin. Kasi your comments are very, very important. Kasi pati ako, gusto ko rin matuto more. And Sir Omer is raising his hand. Sana maganda na yung audio, Sir Omer. Ano po yung dapat nating ayusin dito? Are you happy with, did you learn anything today, tonight? Nawala na si Sir Omer. Baka nagtampo na.
No.
Okay.
Yes, sir.
Sige po.
May general assessment, sir, because before I was zero knowledge when I attended this podcast.
Ano daw?
Sir Omer, can you improve your audio? Parang, ewan ko, lalong lumala yung aking kidney deficiency.
Hello?
Oh, yan. Sige po.
Okay na po. Sir, may general assessment. I don't have any knowledge in acupuncture. That's why I attended
Nawawala siya.
Nawawala.
Sige sir, baka ano.
Baba yung yung
sige po. So,
sir, I will fix my audio.
Sige. Can you speak like closer to the mic?
Hello.
Parang kakaliver young rising. Sige, sige, balikan natin si Sir Omer. Let's continue. Ma'am Annalyn, I'd like to hear from you. Ano po, are you happy with so far the last 3 weeks?
Yes po, very happy. Although meron akong mga video na habulin, pero itong April, ngayon na Holy Week, talagang ipupursige na mapaulit-ulit kasi minsan yung mga video na 18 minutes na, nag-1 hour ako kasi magpupuso na, magsusulat na. Uulitin na naman yung video para lang makakope up, maintindihan talaga. Pero so far, ang ganda-ganda. sobrang na-appreciate ko yung TCM natin.
Ano po
Lalo
yung dapat
opo,
i-improve natin?
yung pasunod-sunod.
Ano pa sunod-sunod? Yung mga panonoorin yung video? Ano din naman pinapanood?
Opo. Napapanood naman po, pero napapanood majority naman, pero merong mga nabibitin, kaya yan babalikan ko this Holy Week. Yung may mga na-miss man na konti. Pero sobrang na-appreciate ko, lahat naman ng ay pinag-print. Kasi
Pinirin po lahat, ang dami noon.
yung sa ngayon na weekend, nandito lahat. Yung para sa ngayon na weekend.
Wag mo na kayo print ng print. May ipapadala pa ako madaming notes. Actually, naka-outline siya.
Na-print na yun lahat. Yung mga lang, yung mga books lang ang hindi talaga. Pero okay lang. Okay lang kasi mas natututunan ko talaga pag naka-print kasi nababalikan ko. So babalikan lang yung mga pages na kailangan talagang maisaulo.
Paulit-ulit po ito ha. I don't know if I'm doing the right thing, but I don't want kasi yung saturation. Gusto ko kasi medyo yung nyo. Tanungin natin si thank you po, Ma'am Annalyn, si Sir Brian, na I'm sure puyat na puyat, pinanood ang mga video o tiningnan lang.
Ayun po, Doc. Maganda ang TCM kasi siya, malalim eh. 1,000 years ba naman yung ginawa ng mga Chinese para improve. Ano lang po siguro sa akin, familiarization. Tapos yung mga, kasi iba yung iba yung approach ng Western, iba rin approach ng ng mga Chinese. As a foundation yin yang. Siguro para sa akin na lang po, familiarization po sa akin. Tapos kung paano ko po maiintindihan kasi bawat tao may kanya-kanyang learning eh. Ang lang siguro po, Doc, sa akin kasi limited po yung time, hindi ko talaga mapanood lahat. Lalo kapag maraming videos. Pero tama naman po, maganda naman po pag maraming video, okay lang po. Pero sa akin po kasi
naman sa inyo yung video, di ba?
Opo. Email ay iba po ata wala.
Alam niyo pa, yung ituturo
Pero okay lang po.
Yung ituturo natin sa module 1, yun lang talaga yung alam ng mga acupuncturists.
Ang ganda nga po kasi
i-condense natin. Kasi you know what I'm planning to do? Sa module 2, we will focus more on diagnostics. This is something na hindi magaling yung iba. No?
Opo.
I tell you, pag nakuha na natin, paulit-ulit lang po yan. Oo. So, konting pasensya lang. So far, we have taken up the kidney and the heart channels, di ba? I think we've also done bladder and small intestine, and also pericardium and liver. So next week, 3 siguro, and then we'll go to the types of qi. No? Okay. Thank you po, Sir Brian.
Thank you po, Doc. Thank you po.
Sa tingin nyo ba, maganda yung kahinan na nito? Tanungin natin si Mark Anthony, Sir Mark Anthony, the great psychic.
Sa akin po naman po ay unti-unti ko naman po pinag-aralan po yung mga video po pag wala po akong ginagawa. Kaso natatapos po ako mga gabi na po eh. Pero tong Holy Week na po ito, asisikapin ko po na mapanood lahat ng video po talaga. Pero yung kagandahan po nito na paulit-ulit ko naririnig, nag-remind sa ulo ko kahit di ko siya napapanood yung ibang video.
Okay. Paulit-ulit. Repetition
na
is...
Medyo nauunawaan ko siya. Kaya po, mas maganda para maalala mo yung mga cycle ng kung ano yun. Yan. Sa Holy Week talagang focus talaga ako. Wala akong gagawin talaga.
Oo. Talking about the cycle, ano doon yung hindi mo alam?
Sa cycle naman po ay paikot-ikot din naman po eh. Aaralin ko lang po, Doc.
Alin doon yung normal? Alin doon yung hindi? Di ba yung generating cycle or the Shang cycle? kapartner niya si controlling, or the cycle. These are normal. Pero yung abnormal, yung over-controlling, at saka yung insulting, or the Wu cycle. Over-controlling or Cheng cycle, then the insulting. Yun po yung pathological. Anyway, wag po kayong mag-alala. Hindi ko naman ine-expect na malulunok nyo lahat yung sinaksak ko sa inyong mga lalamunan, no? Alam ko, gusto ko lang makita kung hanggang saan yung kaya nyo. Alam ko naman, hindi nyo siniseryoso eh. No? Siguro 1/3 lang doon ang pinapanood nyo, if ever nanonood kayo. But let me remind you, yung ginagawa natin every Saturday, ito po yung pinakamatindi. Because this is what every practitioner should know. Okay? So maraming salamat po sa inyong comments. And I would welcome suggestions or comments that are very constructive. Oh, let's call on Sir Herbert. Mukhang ngayon ko lang nakita yung mukha ni Sir Herbert. Pangatlong week mo na ba ito, Sir Herbert?
Yes po, Doc. Kaso po, hindi pa ganun ka, ano yung kaalaman. Kaya napakaganda, Doc, kasi napagtugma-tugma ko yung connection and then yung mga relationship ng mga points sa katawan natin, and then yung mga illnesses and sick. So, nakukonect natin by studying, Doc.
Very good. So actually, when it comes to points, we will categorize the points. No? We will probably start with the 5 shoe points. That's 60 points that you have to memorize. So doon pa lang matindi na. And you should understand bakit po yung ginagamit. At the same time, siguro by gusto kong i-integrate yung anatomy sa diagnostics. No? Kasi yung diagnostics natin, this is not just about locating the points, it's also about palpating the points. Palpating the channels, kung ano yung nakikita mo. Okay, so maraming salamat po. Mukhang pagod na kayo. And nagpapasalamat po ako sa inyo na tiniis nyo talaga. Kahit yung yung galing Boracay dyan, parang antok na. So maraming salamat, and let's all work hard for the future. And ang pangarap lang naman namin, especially ng founder ng LAMP, is to see all of us becoming medical acupuncturists in the future. No? So that means we can work together with our medical counterparts, and they will be amazed at how good we are, because we can explain what we're doing, and we will teach them how to analyze the tongue, how to look at the tongue, how to feel the pulses, how to look at the ear. And I'm sure sa LAMP nyo lang nakita yung naging exciting yung pag-aaral sa ear, di ba? And I know you were all very happy about the balancing points, no? Oo. Kasi sa ngayon, you have to be updated. You have to always be, able to reinvent whatever is old. Kasi times are changing. You have to be competitive. Hindi pwedeng maiwan ka sa ere. No? I'm excited because yung ating supplier ng mga ear seeds, meron na po siyang colored ear seeds. I don't know if you already know that. Di ba 2 lang naman yung pinapagamit ko or 3? Di ba maganda-ganda, iba-ibang kulay, no? Ano pa ba? Tapos yung another good news is yung mayroong mga needles na hindi na masakit, no? Oo, pero medyo masakit ng konti ang presyo, pero tiisin na lang natin. Ang importante is yung pasyente is happy, no? And always remember na pag hindi na kaya magbayad ng mga pasyente, baka pwede na naman ilibre. Huwag naman yung ginawa mong 50 pesos, no? Katulad nung iba. It's either charge mo ng ano or libre mo na, di ba? Sana siya na mag-uwag na. Anyway, so, Herbert Aguirre is still raising his hand.
Sorry po, napindot lang po. Dok, pwede mo magtanong? Pwede ba
Po.
nating i-connect ang TCM acupuncture sa mga sports?
Yeah, sure. Doon ka mas masiyang? Oo naman. Sports.
May
Sige. Dahan lang. Wala pa nga tayong needling eh. Oo.
Salamat po.
Maraming salamat po. Basta gagawin nating malawak yung yung ating skills. No? We have to be globally competitive. And thank you for choosing LAM. Who else? Hindi ko natatanungin yung mga kilala ko kasi baka puro lang alam ko naman sasabihin. Sino pa ba? Si Sir Mark, mukhang ang tapang na ng mukha. May binabasa na naman yan. Diyos ko. Kilala niyo ba si Sir Mark? Huwag talaga kayong lumapit. Nakikita niyo yung mga pinagdaanan mo. Okay. So, okay, wala na. I'm sure antok na po kayo. Thank you very much for joining us.
Salamat po.
Unless may mga
Salamat, Doc.
meron tayo pa next Saturday ha. Huwag kayong umalis. April 1. Then magbe-break tayo ng isang linggo because Holy Week. Para kaawaan naman tayo ni Lord. No? So maraming salamat po. See you again on Monday for the
Thank you po, Doc.
night, everyone.
Thank you po, Doc.
Bye po. Ingat.
Thank you.
Thank you, Doc. See you on Saturday, April 1. Good night po. Bye-bye.
Good night po, Doc.
Good night, Doc. Good night, everyone.
Panoorin niyo yung video na saan ang gagaling ninyo. Bye-bye.